Hi, I'm going to discuss the nervy symptoms today. What is nervy symptom? The symptoms that are originating from the injured nerve. Okay, what is a nerve? The nerve is the connecting fiber or something like an electric wire that connects from the main switch to the motor. So the connecting line is called as the wire, right? Similarly, the body has the connecting lines which is called as nerves, and these nerves connect the central nervous system to the end organ. What are the end organs? The end organs can be the muscles, it can be the bone, it can be the joint, ligaments, fascia, even the skin, even the organs or the blood vessels. So any structures which are innervated or connected by these wires will have to obey the law of the nervy symptoms. So these nervy symptoms can be happening when the nerve is injured. A single nerve is the amalgamation of multiple fibers within that. It's something like a rope, a single rope. If you actually remove the parts of the rope, you can get that individual fibers. Like that, a single nerve will have hundreds to thousands of small nerve fibers. A typical nerve will have sensory fibers which look after the sensation of the skin, and motor fibers which look after giving the orders to the muscles so that the muscles can contract. It also has a vasomotor fiber, that means the nerves governs the blood vessels too. Thereby the blood vessels can constrict or dilate depend upon how the end organ is demanding the blood. So that's how the BP can be regulated during exercises by this nervous connection to the blood vessels. So the nerve which is governing the blood vessel, that connection is called as vasomotor connection. So do understand, a single typical nerve in the body has sensory fibers, motor fibers and vasomotor fibers. Now if problem happens in this nerve, it depends upon which fiber is affected. Some of my patients, they say that, doctor, I have my last 2 fingers becoming numb. Okay, so we know that the sensory fibers of that particular ulnar nerve here is affected in this patient. There are so many types of sensory abnormalities. Some people will have tingling numbness, some people will have paresthesia, some people will have complete numbness or complete loss of sensation, some people will have hand crawling sensation. If the sensory fibers of the nerve are damaged either by inflammation or infection or space occupying lesions or by mechanical compression, as in the case of disc bulging compressing the nerves, in such instances the sensory fibers, when they are affected, you get this list of symptoms. So do ask questions to your patients pertinent to, do you have tingling and numbness, do you have paresthesia, do you have pins and needles. So if they say any of these symptoms, it is almost sure that the nerves are affected. The only job for you is to identify at what level it is affected and what is the mechanism of injury to the nerve. Is it trauma or is it infection or is it tumor or something else? You need to identify. But do understand that the moment the patient say numbness or tingling or paresthesia, it is always going to be a nervy symptom, because no other structures in the body can cause numbness and paresthesia like the nerves. The nerve can also have their motor fibers affected. When these motor fibers are affected, the orders to the muscles will be disrupted. Once the orders are disrupted, the muscles cannot able to function properly, and these patients will say that I'm not able to grip my glass of water properly, I'm not able to have a control of my footwear, or when they are walking in the mall, they have to walk for long distance, that's when they feel their legs are very tired. So when the nerves are governing the muscles are affected, the muscles will feel tired, it can be heavy, it can be even get cramped. Sometimes at night it causes cramp. There are multiple reasons, there are various reasons for cramp. One of the reasons for the cramp is neurogenic cramp. When the nerve is affected, the muscle can get cramped. Some of my patients, they say that legs are getting tight and heavy. The sense of tightness and the sense of heaviness is to be addressed as neural problem unless it's proven otherwise. And that's the reason why when these patients are undergoing multiple times of stretching exercises, they still feel the legs are still feel heavy and tight. Okay, so in such case, it is not to be called as a true mechanical tightness of the muscle. It's a neural tightness which is perceived as a mechanical tightness or which is perceived as a muscular tightness. They say that my hamstrings are always tight or my upper trapezius is always tight, it feels very heavy. So the sense of heavy, the sense of height is just a sensation, is not true mechanical tightness. Unless it's proven otherwise, you need to treat it as a nervy symptom. Rarely, some patients will undergo paralysis. This is an extreme case scenario when the patient's muscles will get paralyzed. For example, in severe disc herniation, one can get a foot drop or a toe drop, or they even get bowel bladder paralysis. So in such cases, we think that the motor fibers are completely disrupted, that no amount of orders are passing through the muscle, so the muscle is undergoing paralysis. But remember, even before this happens, the body gives hint by giving all these symptoms, but these symptoms are not so catastrophizing, so people take these symptoms as light symptoms, and hence at some point they may end up getting this paralysis. This is a very rare case scenario, that 1 in 1000 or 1 in 5000 people will be ending up getting the paralysis, but majority, almost like 90 to 95% of the people will be having these symptoms. They live with these symptoms, and then sometimes they die with these symptoms without even getting the paralysis. Thirdly, the nerves can also affect the vasomotor functions. Do you know this interesting fact that the nerve and the blood vessel, they always travel together? That's why we call it as neurovascular. It is essential because the blood vessels are governed by the nerves. The nerves can cause vasoconstriction and vasodilation. Similarly, the blood vessels give blood supply to the nerve, because the nerves cannot survive without blood supply. That's why they always mostly travel together. So the nerves which is governing the blood vessel, those fibers are called as vasomotor fibers. When the vasomotor fibers are affected in the nerve, it cannot give proper orders to the blood vessels, so the blood vessels will stop constricting and dilating. So these patients end up getting sometimes swelling, sometimes cold intolerance, because lack of blood supply will cause the extremity to be cold. So such cold will be sensed as an intolerance by the patient. So, and they also will have touch and pressure sensitivity. Touch and pressure sensitivity is the combination of both vasomotor and sensory. So these patients will be having sensitivity to touch. Whenever you squeeze their arm, they feel like it's painful. When you squeeze their calf muscle, they feel that it's painful. This is something I always test in my clinic to know how much is the sensitivity of the body for touch. Okay, when the touch itself is sensitive, we know that the nerves have been compressed for quite some time. In that way, we gauge the chronicity of the problem. That is the compilation of the nervy symptoms. I'm not saying every patient will have all these symptoms. Some patients will have some symptoms. It depends upon so many factors. It depends upon which nerve fiber is affected, how much is the blood supply affected to the nerve, how long the compression is. If you know all these symptoms, and then if you ask questions to your patients pertinent to these symptoms, then you will have some clarity of whether the patient's nerves are affected or not. Once you know that it's coming from the nerve, it's your job is to identify at which level the nerve is affected. Is it in the pathway of the nerve, or is it in the spinal cord level itself which is compressed? For example, in carpal tunnel syndrome, the pathway is affected. It's not the C5, C6 nerve at the spine level is affected. It's in the nerve level, in the carpal tunnel level, it's affected. Similarly, there's something called cubital tunnel syndrome, where the nerve gets affected in the elbow level itself. In thoracic outlet syndrome, the nerve is getting affected in the thoracic outlet itself. But most common of all is the nerve getting compressed at the spinal level itself, where the disc is bulging and compressing the nerve. That's the most commonest reason of nerve impingement than any other peripheral nerve entrapments. Sometimes the nerve can get injured due to road traffic accidents, or it can be infected. For example, in Bell's palsy is an infection of the facial nerve. In herpes zoster, the infection can happen at any nerve, or even in Guillain-Barré syndrome, the nerves can get inflamed. It's a form of infective autoinflammatory disorder. All you have to identify is it a nervy problem? If that is the case, where it is affected? Is it in the periphery or in the center? If it is in the center, what is the reason for that? Is it infective? Is it mechanical compressive? Is it inflammatory or autoinflammatory? Or is it traumatic? Or is it tumor within the nerve? So these are the common reasons of how the nerve can get affected. If you know all these things, it is easy for you to make precise diagnosis in your clinic, so that you can direct the patient to the respective healthcare provider, or you can choose to treat in your physiotherapy clinic itself if it is a spine related nerve compression. I hope this information is useful to you, so use it in your clinic. Okay, thank you.